In the present case, the adjacent tooth number 21 was restored beforehand with a crown made of IPS Emax Press Multi. Owing to the subgingival preparation margin, the gingiva is traumatized. Remove the temporary restoration. Clean the preparation with a polishing brush and a fluoride-free cleaning paste, such as the fluoride-free Proxit. This ensures that all temporary cement residues are removed. Rinse the preparation with water spray and dry it with water and oil-free air. For optimum aesthetic results, use variolink N try-in paste to evaluate the shade of the restoration. When trying in the permanent restoration, check the shade effect, accuracy of fit, and occlusion of the restoration. Thoroughly rinse off the try-in paste with water spray after try-in, and dry the preparation with water and oil-free air. Etch the bonding surface of the IPS Emax restoration with 5% hydrofluoric acid, for example, ceramic etching gel, for 20 seconds. Rinse off the etching gel and dry the restoration. If the restoration has been etched in the laboratory, clean the bonding surface with IvoClean. For this purpose, apply IvoClean to the entire bonding surface and leave it to react for 20 seconds. Then rinse off IvoClean and dry the restoration. Apply Monobond N bonding agent to the pre-treated surfaces using a brush or microbrush, and allow it to react for 60 seconds before dispersing any excess with a vigorous stream of air. When an adhesive luting protocol with composites is used, reliable isolation of the operating field is indispensable. Preferably place an atomically shaped rubber dam, such as the Optradam, or alternatively, use cotton rolls and a saliva ejector. Clean the preparation again with a polishing brush and a fluoride-free cleaning paste, such as the fluoride-free Proxit. Rinse the preparation with water spray and dry it with air. Avoid over-drying. Apply phosphoric acid gel, for example, and etch onto the enamel and then the dentin. The etchant should be left to react on the enamel for 15 to 30 seconds and on the dentin for 10 to 15 seconds. Thoroughly rinse off the gel with a vigorous stream of water and air dry the preparation until the etched enamel surfaces appear chalky white. Coat the entire bonding surface with Tetric N-Bond Universal and scrub the adhesive in for 20 seconds. Disperse excess amounts of Tetric N-Bond Universal with a stream of air until the mobile liquid film has disappeared. Make sure to avoid pooling. Light cure Tetric N-Bond Universal for 10 seconds using a curing light with a light intensity of at least 500 milliwatts per square centimeter. For example, Blue Phase N. Apply the desired amount of variolink N LC directly from the syringe onto the restoration. Seat the restoration and retain it in place, exerting uniform pressure. Make sure to remove gross excess within the processing time, especially in proximal areas and gingival margins that are difficult to reach. Maintain the pressure and light cure the central area of the restoration for 3 to 4 seconds at a light intensity of 650 milliwatts per square centimeter, using Blue Phase N in low mode, for example, to tack the restoration into place. Like all other composite resins, variolink N LC is subject to oxygen inhibition. To counteract this effect, cover the restoration margins with glycerin gel or air block immediately after having removed the excess cement. Liquid strip is an ideal product for this purpose. Light cure the restoration again for 10 seconds per millimeter thickness and segment at a light intensity of at least 800 milliwatts per square centimeter, using Blue Phase N in high mode with 1200 milliwatts per square centimeter, for example. Rinse off liquid strip. Finish the proximal surfaces using finishing and polishing strips. Polish the restoration margins with polishers, such as Astropol or with discs. After having removed the cotton rolls or the rubber dam, check the occlusion and functional movements and make adjustments if necessary. As a final step, apply a thin layer of floor protector using a Viva brush or a conventional brush. Use the air syringe to disperse and dry the varnish.